so that you shall respect each other. Not that you may fight with each other. In this verse of the Quran, Allah says that the criteria for judgment in the sight of Allah is not sex, is not wealth, is not color, is not race, but it is taqwa. It is righteousness, it's God consciousness, it's piety. The only criteria that one human being can be superior to the other human being is by taqwa, is by righteousness, is by God consciousness. Allah says in the Quran in Surah Baqarah chapter 2 verse number 153 that seek help with patience and perseverance and prayer. Inna Allaha ma sabrin. Verily, Allah is with those who patiently persevere. Allah says in the Quran that seek help with patience, perseverance and salah. Inna Allaha ma sabrin. Verily, Allah is with those who patiently persevere. There are various benefits of salah. You can go on and on speaking for hours together. Time will not permit us. I will just speak about some of the medical benefits of salah. You can speak on speaking for hours on the benefits of salah. I'll just touch on some of the medical benefits of salah. Normally in a salah, when we do ruku, when we bow down, the blood flows in the upper part of the body. And there is relaxation of the body. The spine gets supple. There is nourishment of the spinal nerves and the back muscles. This position is good against flatulence. When you come back in the standing position, a rafu position, the blood goes back normally and you relax. Then you go in the sajda position. Sajda is one of the best position of salah. Normally, our body is under our control, but our mind is not under our control. And as I told you, our mind keeps on wandering. But our body is under our control. So the best way to humble our mind is to humble the body. Put the highest part of the body, the forehead, on the lowest part on the ground, Subhana bin Allah. Glory be to Allah, the Most Highest. Glory be to Allah, the Most Highest. Because our mind is not under our control, but our body is under control, the psychologists they tell us the best way to humble our mind is to humble our body. That is sujood. In sajda, there are various medical benefits. Normally, the human beings throughout the day, they get electrostatic charges from the atmosphere. And this electrostatic charges gets precipitated in the central nervous system. You may have seen the difference between a 2-pin plug and a 3-pin plug. The 3-pin plug, the third pin is for grounding. So when the electrostatic charges are there throughout the day, there are high chances you'll have headache, you'll have neck ache and muscle spasm. These electrostatic charges have to be grounded. And there is no better way of grounding than by putting your head, your forehead onto the ground. In the sajda, when you're putting your forehead onto the ground, the electrostatic charges gets grounded. The third pin that is there is attached into the ground. So in the salah, in sujood, in sajda, your electrostatic charges get grounded. If you put your hand below the prayer mat, you won't get a shock. But it's a scientific phenomena that the electrostatic charges that are there, it gets precipitated into the central nervous system. So in the sajda, these electrostatic charges get grounded and it gives you peace. Number two, there is increased flow of blood into the brain, which keeps the brain healthy. Number 3, there's increased flow of blood into the face, which keeps the face healthy, especially in the cold season. It prevents you from having disease such as chilblains and fibrositis. When you're doing sajda, there is drainage of the sinuses. And the maxillary sinus, the ostium, the opening, is on the top and the medial part. Like when you want to empty a pot which is filled, when you turn it, it gets emptied. So in sajda, the maxillary sinus gets drained. So person who has maxillary sinusitis, he often has afternoon headache. So person who does sajda, the maxillary sinus is drained. Even the other sinuses, like frontal sinuses, ethmoidal sinuses, sphenoidal sinuses, all of these get drained. So if you are for 5 times salah, there are less chances you'll have sinusitis. When you do sajda, there's even drainage of the bronchial trees in the lungs. The secretion of the lungs, they get drained. There is less chances you'll have bronchiectasis. Less chances you'll have disease of the lungs. When you do sajda, normally when you breathe, only 2/3 of your air in the lungs is breathed out. 1/3 lower part is called as residual air. So normally when you breathe, when you are standing, only 2/3 of the air is exhaled out. Unless you take a deep breath, it's different. But normally when you breathe, only 2/3 of your air is exhaled out. The remaining 1/3 is called as residual air. In sajda, the abdominal viscera presses against the lower lobes presses against the diaphragm, and the diaphragm presses against the lower lobes of the lungs, and even this residual air is exhaled out. So when you breathe, while you're doing sajda, more fresh air comes in. All these are scientific benefits. So the abdominal viscera presses against the diaphragm presses against the lower lobe. So when you breathe in sajda, there is more fresh air coming in. You don't have to do the breathing exercises of people spend hours. In salah, you get many exercises inbuilt. When you're doing sajda, there is more venous return of the abdominal viscera because there is less gravitational on the abdominal viscera, because in sajda the position is such. So because of that, the venous return of the abdominal viscera is increased. Because of sajda, this position, it is a prophylactic treatment for femoral hernia as well as esophageal hernia. The ruku position and the ruku for esophageal hernia. And the sajda position, it's a prophylactic treatment for femoral hernia. It's also prophylactic treatment for a person suffering from hemorrhoids. You call it piles. The common people call it piles. The medical terminology is hemorrhoid. So it's a prophylactic treatment for hemorrhoids and for uterus prolapse. For a woman who is suffering from uterus prolapse or hemorrhoids, this is a prophylactic treatment. When you're doing sajda, there is an increased venous return. So in the sajda, the position is such that you are placing your weight on the knees and your hands and on your forehead. And today science tells us that the soleus muscle, the calf muscles, they are called as the peripheral heart. They are also called as secondary heart. So in the sajda position, because the weight is on the knee, on the feet and on the hands, there is pressure on the calf muscles. Because of that, blood is pumped to the lower part of the body. It is the peripheral heart. In this position, The sajda position even strengthens the muscles of the leg, of the knee, of the thigh and of the spine. There's less chance of having disease of the spine. In this position of sajda, there's less chance of having disease of the knee.